The following segment is sponsored by 901 Vascular.
Good morning. A service here in the Mid-South works to provide some of the most focused outpatient vascular treatments in an effort to improve patients' lives. To learn more about how they treat diabetes and wounds, we're joined by Lauren Albertine with 901 Vascular. Thank you so much for coming in.
Thank you for having me, Kanji.
Yeah, so we were just talking about one of your patients and how you were able to pretty much save their leg.
Yes. One patient in particular comes to mind. He had these several wounds on his legs that he was told that most likely he was going to have an amputation because they were so acute and concern of invasive infection. We completed an arteriogram on him, which opens up arterial blood flow to those wound sites in order to hasten healing, and we were able, with advanced wound care, heal those wounds, and he is now walking his desired distance without pain. Those wounds are healed, and we were able to help manage and guide and educate him on how to manage his diabetes so that we can prevent this from happening again.
Well, with all that delicious comfort food in our area,
exactly.
You know, and diabetes is a big thing, and
yes,
it affects millions of Americans. Why is this important to your overall health, to just control your blood glucose levels?
Right. So what most individuals don't think about is that the negative effects of high glucose levels starts before even the diabetic diagnosis.
So no sweet potato pie or pumpkin pie?
No
just
sweet potato, yes.
Well, you can. I mean, right, just in, I'm sorry.
Just in small doses, right?
I digress.
Yes. So that high blood sugar negatively affects the eyes, the kidneys, the heart. It could possibly, severe effects would be a stroke, heart attack. It also affects the limbs with the vascular flow, decreases that arterial flow to your legs and your feet, and also can lead to wounds as well.
Well, you know, you don't think about the eyes, so that was a very interesting fact. What are some of the reasons that someone might be more prone to skin infection or wound development?
Right. Another negative effect of diabetes is something called neuropathy. This is when there's a decreased sensation in the periphery. It's often called gloves and stockings because it initially affects the hands and the feet and legs. And so if a patient's wearing ill-fitting pair of shoes, the toe box is too narrow and it's rubbing on a bony prominence, that patient can develop a wound. They have no idea because they can't feel it. They can't feel the pain.
My bony prominence has definitely felt a lot of narrow shoes.
Yes. And luckily you can feel that and you know not to wear those shoes anymore. And with diabetes, if you have neuropathy, with many do, they can't feel that.
You say to check both legs.
Yes. So we encourage patients with diabetes to check their skin every morning, their feet and their legs, and at night after a long day wearing shoes. For instance, if someone is working where they have to wear a steel-toed boot, those are very stiff shoes that can cause rubbing on the feet. And that individual needs to have a baseline. What did my skin look like in the morning? What does it look like now after work? So they can catch a wound if it's developing.
Okay, and what about a wound that's not healing? Isn't that kind of like a thing to look at?
Oh, definitely, because a diabetic foot wound can become invasive very quickly, which in the most severe case can lead to an amputation. So if a patient has a wound that is chronic, non-healing, they're not seeing progress with it, they need to let their primary care provider know right away. And so that primary care provider can send a referral to advanced wound care, such as 901 Vascular. And all wound care starts with an arterial assessment to make sure that wound is getting the proper blood flow for healing.
And we can just call down? Is that the best way? How do you get in there?
So you can call, a patient can call, we have patients call all the time. We can set them up. We just, as a specialty office, we need a referral from the primary care provider. But a patient definitely can call and we can start the process then.
All right, 901 Vascular, thank you so much for helping us understand this very important issue.
It's my pleasure. It's a passion for me.
Oh, okay, thank you. We'll be right back.